And that's especially important for those who are at risk. Medical professionals say that people with intellectual and developmental disabilities are actually 5 times more likely to contract the coronavirus. As 41 Action News reporter Emma James explains, a telemedicine service works to prevent that by keeping those folks at home when they can.
Here at the Center for Developmentally Disabled, staff members use the service because they aren't medically trained, so having that expert opinion can make a huge difference. A local parent tells me that is true. He's already had an experience where Station MD helped him and his son out a lot.
It's a win for me, big time.
David Earls says his son Edward, who lives with nonverbal Down syndrome, spiked a fever last month. Instead of going to the ER, a Station MD doctor took a closer look at his symptoms and advised him to stay home and take Tylenol. His fever broke overnight. David says the expert opinion saved both of them a trip to the hospital and the 2-week quarantine that would have followed, which Edward's living community requires.
Had I taken him to the emergency room, he and I would have been faced with very, very difficult circumstances. Where would we go for quarantine? I don't know.
Station MD connects people with IDD and their direct support professionals to licensed physicians 24/7. One of those is Dr. Malik Trivedi. He says the goal is to keep those folks home where the risk of contracting COVID-19 is low.
What we saw was unnecessary visits to the emergency room or urgent care for this population. And we really could treat them, we thought we could treat them better.
Dr. Trivedi says about 80 to 90% of the time during Station MD visits, the person with IDD can be treated at home. Sarah West with the Center for Developmentally Disabled in Kansas City says the organization jumped on board as soon as possible.
The Station MD doctors are able to see people and send prescriptions directly to the pharmacy. They're able to send us documentation of the visit.
West says she hopes the Missouri Department of Mental Health continues to fund the service so the CDD can benefit from it even after the pandemic. In Kansas City, Emma James, 41 Action News.
And Station MD is free to all of Missouri's Medicaid waiver recipients. About 15,000 people receive those waivers, which is why the service is working to get the word out.